She's having a mint lift of her mid-face in jowls using 8 of the mint 43s. You see the 8 marks on each side because they are U-shaped threads. We're giving tumescent anesthesia, starting with a 30 gauge needle and then using 25 gauge 2-inch long needles to go subcutaneously in a tumescent fashion, 50 cc's of 0.5% lidocaine with 1 to 200,000 concentration of epinephrine per side, making it certain to not only tumescent the whole thing, but giving extra at these 8 exit points on each side, because they're the thing that she actually feels the most, and it's the thing you don't want to bleed. And then you want to prep the face with HiPoCleanse, put on a head drape, and if there's anything that's not white, go ahead and inject some more. I make 4 1.5 millimeter punch incisions into the temple. You can try to put a little tegaderm to try to keep the hairs out. Make sure you put a little hole in there. Hairs tend to get dragged in with the cannula and the threads. So then you put in this temporal needle. Do not go deep. You're going to go mainly horizontal there. You're going to go twice, and then you put in 2 threads in each one. And then you want to pass deep in the deep sub-Q. Up in the temple, not so deep, but then when you're on the cheek, deep enough. But just make sure you don't go into parotid, so there you're actually not as deep when you're on these first ones. You always pull back on the blunt cannula so that the sharp cannula can then poke through the skin, and then you're threading each of these. On the top one, don't use the highest one. We'll show you more on the other side. Then you need to pull all the soft tissue up on the barbs, literally as hard as it'll go. And then after you've done that, then you need to cut these really short. You push down a lot on the skin to make sure they're as short as you can cut them. You release any dimples slightly. Always grab the hairs that have followed the threads, and they will always go in. Pull them out. Add a little more local to the temple area, and anywhere that's not white, put in those 4 1.5 millimeter punch incisions. Make sure you get the little piece of skin and scalp out with it. Sometimes you gotta get an angle to do that. Then you make those 2 passes with the temporal needle. Do not go deep, barely thread it and pull the temporal needle back. And then go ahead, I like to start on the top one, but do not use the frontmost one. You get too close to the eye, use one a little further back. And then you're passing deep in the cheek, you're going on top of the muscle lobe. The numbing, which made it painless and prevents all bruising, is what caused that swelling. But you see it's gone in 6 hours. Here you see her 2 days later. She looks much younger and has no pain and no bruising, and the face is markedly lifted, and it's going to stay lifted for a year.